Hello and welcome back. This is Dr. Namnehra, and today's video is dedicated to all the NBEMS residents who are preparing for the FAT exam. I'm sure you all have seen the notice, and you know the date for the FAT theory exam is June 18, 2023. In this video, I'm going to tell you everything you need to know about the FAT exam. Now, what is FAT? FAT is the focus assessment test conducted by NBEMS for its resident doctors, regardless of the course, regardless of the subject you are doing your PG in. The 2-year courses have their FAT exam during the first year, and the 3-year courses have their FAT exam during the second year, usually. Now, FAT is usually of 3 parts. Part 1, the theory exam, the written exam, which you're going to have on June 18. The practical exam, which will also be called the workplace based assessment. And the third part is the counseling, how you performed in both those theory and practical. In this video, we are going to talk about the theory exam, which you're going to have on June 18. So, to appear in the FAT exam, you need to apply for it, which, don't worry, is your institution's job. Your institution is going to apply for the FAT, your institution is going to pay for the FAT. Then your institution is going to receive the admit card and the institution will hand it over to you, which will usually be by 12 or 15 of the June. And then 18 of the June you'll be going to the center and writing the FAT exam. Now, how will that look like? This was my admit card, and this is how my exam was conducted last year on December 10, like paper 1 in morning and paper 2 in the noon. You're gonna have a similar thing. You'll be having 2 theory papers in a single day, starting one in the morning session, one in the evening or noon session. Both the paper will consist of 10 questions each, and you have to attempt all the questions. There is no choice. You have to attempt all 10 questions. Each question will be 10 marks and the whole paper will be of 100 marks. So 2 paper of 200 marks. Is that clear? Now, those who are freaking out about the FAT, please don't. The result of your FAT exam, whether you fail or you pass, will not affect your final exam. Your final DNB exit exam will be completely different, and that will have nothing to do with this exam or any other internal assessment exam. But you have to attend the exam. The attendance of your theory as well as practical is must. Able to be in the final exam, to able to be write the final exam, your attendance in the FAT is must. What is the syllabus of the FAT? Everything. They are going to ask you everything. Like, it is going to be just like your final exit exam. You can take it as a demo exam of your DNB exit exam. Can you leave before the time is over? No. You have to sit there for the whole duration of 3 hours and you cannot leave between. The exam will be like 10 questions will be displayed on a screen and you'll be getting a copy of 50 pages, 5 pages for each question, and you have to write in the specific column. Like for question number 1, you have to start from page 1 and end it by page 5. If you go beyond that, that will not be counted. And also you cannot do this from page 1 you will start writing question number 2. No. Page 1, question number 1. Page 6, question number 2. Page 10 or 11, question number 3. So it's fixed. You cannot mix and match the question. You cannot jumble. You cannot exceed the page quantity. You will not be getting any extra sheet. That will be it. Now you can draw anything you like. You can do whatever you want in that 5 pages, but stick to the 5 pages and stick to the time. Now, my suggestion for the FAT exam is take this exam as a benchmark of what you know. Go there with an open mind and sit in the exam, write as much as you know. Take it as an exam, but don't take it to your heart. Write the exam like you are writing a final exam. Then come back home and assess where you stand and plan your studies accordingly. Because the result of this FAT will not affect anything, but it can be used positively by you to know where you stand and what you need to study, what are your weak points, how exactly you need to plan for your final DNB exit exam. They're gonna give you questions that you have no clue about what it is like, and they're gonna give you questions that you exactly know what to write. If you're from ops gynae, then they're gonna give you a question which is like obstetric anal sphincter injuries, which is the most common thing. Like during episiotomy and during normal labor, we have that extremely common thing, and you're gonna be writing it, and you're getting the full marks. And then they're going to ask you something like fetus in utero has this complication, and how would you manage this as a feto maternal expert? You are going to have no clue on that at this particular level. So the exam is going to be from like below average to excellent level, just to give you an idea of what you have to study, what you need to know during this course. So, stop freaking about the FAT exam. Just go there, write the exam, come back, assess on it, and get to study. All the very best, and please go there because the attendance is must. Fail pass doesn't matter, the attendance matters.